every year prior to COVID, we knew the flu season caused us significant problems in the health service. Now, with the backdrop of COVID as well, are we going to cope? What will we see happen in our hospitals?
Good morning, Ciara. Well, none of us would have wished for a winter where we were facing COVID and flu, but I think we're in a more resilient position now than we would have hoped because of all the learnings from the past year and a half. We're in a safer position now with regard to COVID because of the extraordinary reach of this vaccination programme and of the enthusiasm of the Irish people and the way they embrace the vaccine. And that's made our hospitals and our healthcare systems a much safer place. But we've also invested from last year at speed in capacity, particularly hospital beds, critical care beds to some degree, and perhaps more importantly in the long term, given all the conversation about Sláinte care, into ways we can deliver care that don't necessarily bring people into hospital, particularly for those who are older and those with chronic disease.
Okay. I suppose two key issues here. First of all, with regard to the flu vaccination campaign, I was looking at the various groups, the over 65s, healthcare workers, people who are pregnant, people who have any kind of level of undermined health themselves, but also children aged 2 to 17. That's an interesting one.
Yes, we did introduce this vaccine last year. It wasn't taken up in huge numbers. I mean, we know from the UK their experience. I think they introduced it back in 2014, and it was sluggish to begin with. It takes a while for new vaccines to get a grip and to capture the imagination, to be embraced by the public. So we're hoping for a greater uptake of this vaccine between the age of 2 and 17. Last year, perhaps a little bit disappointing, with 29% of those between 2 and 14 took the vaccine. We
a huge amount of the vaccines for children last year were wasted, isn't that fair to say?
Yes, it just did not reach the numbers we would have liked to reach. But on the flip side of that, we saw extraordinary levels of uptake with older people, those over 65, about 71%. Big increase in healthcare workers. And Ciara, we had problems with this, to be honest, over the past few years, getting healthcare workers. But we saw in the acute hospital sector 71%. Now, some hospitals were extraordinary, particular acknowledgement to Drogheda, for example, where you saw, I think, 85% of workers within that hospital setting taking the vaccine. So there's some good work to build on, definitely.
I presume you would urge anyone eligible for the flu vaccine to take it and to get it.
Yes, please do. Of course, we're launching that today, and we're if you like, 3 separate groups, Ciara. The first is those age over 65 years of age, you've mentioned already. The second is children with age between 2 and 17, and the third is those with chronic disease from 17 up to 65. And those are well known. Those people will know from contact with their GPs and pharmacists in previous years. And you've mentioned people who are pregnant, those with long-term conditions, those with particular conditions, long-term residential care settings, healthcare workers, of course, and survivors of cancer. And these are people who are particularly vulnerable to the worst effects of flu, and we want to protect them. And it has been interesting here. One of the curious figures from last year was we had no cases of lab confirmed flu at all, probably because of the fact that people were in their homes and the social distancing. I don't think we're going to get away that lightly this year.
No, clearly not, and perhaps we might suffer quite a bit considering that there was no sort of flu season last year, worth mentioning. We're only 2.5 weeks out really from the easing of almost all restrictions. How do you feel about that in terms of the health service?
I think the vaccine flood wall is holding tight. We see an extraordinary this weakening of the link between the numbers of cases and the harm they're causing. Before, we were so used to that, the absolute predictability of the link of cases and harm, that for every 1,000 cases we saw 30 to 50 hospitalisations and 3 to 5 people in ITU. That link is severely weakened, especially among those fully vaccinated groups. So we're seeing a fraction of the number of deaths, thankfully, much fewer hospitalisations in relation to cases, and certainly much fewer admissions to ITU in relation to number of cases. The pressures are still there, being no doubt about it. This morning we have over 300 people in hospital with COVID. We have there about 60 in ITU, but it's certainly very level over the past few weeks.
And the booster, the COVID booster campaign, does that give you a degree of assurance that firewall, as you say, will continue to hold?
Yeah, absolutely. What we're trying to do is we're recognising that for some groups of people that just don't get the immune response from that 2-dose programme. And we want to target those people. We began, of course, last week. We want to target those people with a range of conditions, meaning that their immune system just didn't get the kick it should have got from those 2-dose vaccines. And we want to give them that 3rd dose, which will bring them up to a level of protection that will leave them certainly much more assured for the winter.